Dr. Johnny Fee, Doctor of Chiropractic here at Key to Change Wellness in Chattanooga, Tennessee.
And I'm Dr. Kelly Fee, physical therapist. I do orthopedic, pelvic, and vestibular physical therapy. So we started Key to Change Wellness because we both worked in traditional practice settings where we felt like we were slowly expected to see more and more people. We weren't able to give the quality of care that we wanted. I think we were both feeling pretty burnt out by that. So we started Key to Change Wellness about 3.5 years ago. And our goal was really to just be able to provide that one-on-one quality care, spend more time with people, give them the experience that we want to have, and bridge that gap of not just dealing with the injury that they're having, but also tying into, what's your nutrition look like? What are you doing to take care of yourself outside of here? Like, how do we get you in the gym doing something you enjoy and getting that full wellness piece with their care?
As far as some of the modalities we do, we overlap a lot, whether it be dry needling, cupping, Groston therapy, manual therapy, which is just a massage-focused area. So there's a lot of overlap there.
Yeah, it's definitely a custom approach based on what our clients need. We're direct access providers, so we don't require a referral from a doctor to see somebody. And this has been how chiropractic has been for quite a while. So what that ends up meaning is we act a lot of times as people's entry point into the medical system. So with our schooling, we get a little bit more of like the well-rounded approach to just health in general. So we can, one, catch things that aren't meant to be in our office and need to be referred on, but also like being mindful of the other pieces that contribute, like nutrition, stress, mental health. And we can handle some pieces of that. Like Johnny has a nutrition certification. I have a little bit more of a background in like public health and prevention. So we kind of know what we can handle, but then we build up this team and then we just start to build that provider network. And so we can kind of quarterback that care and like make sure everyone's communicating. Because I think that's one of the most frustrating pieces of healthcare is nobody communicates and the patient feels kind of lost.
So I think for us, it's just being as open as possible with them. Our intake forms have a questionnaire basically of what are you looking for most in a provider? Is it trust? Holistic approach. We like to look at that ahead of time to know what are they looking for and allowing them to be more open with us. And then I would also say, because of our setting is one-to-one, people are more direct and usually open when it's a one-on-one conversation and you get to know the person. If you were to go to a mental health therapist, you feel more open talking to them because nobody's judging you or anything. So a lot of times we find that they'll be more open about that. And it might not be on the initial visit, for maybe a couple visits, they realize they're getting better, they trust you more, and then that unravels from there. And that's what it comes back to, is really getting to that root cause of why are they in here today? Even though they're looking for relief, there might be other pieces to the puzzle that we need to kind of pull out and identify there.
Yeah, and asking the right questions when somebody's not progressing like we expect, because that's kind of, especially, if it's visit 4, visit 5, and we're like, this isn't going exactly how I planned. Well, maybe that means we need to bring somebody else in, but maybe they're getting more comfortable with us and we start to find out like, oh, there is a personal stressor that's really contributing, and that's why they're so tense, because they're just in a constant state of stress. So maybe we need to bring in like a mental health professional and work side by side. So it's just kind of keeping that constant tab on them.
I would say one of the big pieces that we've added in is like any kids that come with an adult, if they're being treated, that kid it's a free adjustment. Like I don't charge for it because I'm big on that proactive piece. If they're willing to allow me to, help their child out, that's awesome. So their child can get the experience before they're an adult. So I'd say that's probably one of my favorite things is to work with a child that's never experienced it, to kind of be proactive about the approach.
Treatment standpoint, I think I have started to really see a lot of people that have maybe been through like prior physical therapy, whether it was like after a surgery. I have a few people that are coming to mind, like after joint replacements, where they did like their full bout of physical therapy, but they're really active, like high performing people, and they get back to doing stuff. So from an insurance standpoint, it looks like great, we checked all the boxes, but they're not happy. And being able to kind of get them to that next level of like, I thought maybe this was how it was going to be forever, but you showed me that I can be pain-free and like I can do the workouts that I want to and like get back into things like that. So helping people get back to like those bigger goals that they maybe thought were like off the table for them is probably one of the most rewarding pieces.
Yeah, I would agree with that one too. That's always fun.